And today we have with us Dr. Sarah Kemble and Dr. Nathan Tan. Dr. Kemble, did you want to kick us off?
Thank you, Katie. I wanted to start by reviewing some of our latest COVID-19 data trends. We're happy to see cases coming down over the last few weeks, overall case numbers declining. That being said, we do see some slowing in the rate of decline now, and so that raises the question of whether we may be hitting more of a plateau at this point. We also had a notable 20 deaths reported in the last week. And this is a trend that I also wanted to comment on. These deaths are not all deaths that occurred in the last week. These are deaths that may have occurred in preceding weeks and just got reported to us. That being said, we do have on our website trend charts that show overall trends in deaths. And we are seeing now the impacts of this latest surge of Omicron that we had over May and June. And so as we know, deaths are a lagging indicator, and we do see those deaths emerge as the peak of the actual cases may be passing us by. These deaths are not really changed in character from what we've seen previously. We're still seeing deaths predominantly in older age groups. I think it's really important to note that to date, about 75% of Hawaii residents age 50 and older have not received a second booster dose, and about 61% of those 75 and older have not received a second booster dose. And that's looking at our recent deaths where, and even deaths over the entire pandemic, over 90% have been among people 50 and older. So it's really important. We do know that boosters provide protection against severe outcomes from COVID-19, including hospitalization and death. It's really important to go and get that booster, especially for those older age groups. We are otherwise continuing to track the trends, and we'll continue to review and see what other trends may emerge. We're watching variants closely. We are anticipating our next variant report to come out later today. What I understand as of this moment is that BA1 and 2 are still the predominant strains. We are seeing some BA4 and 5, but at this time, they are still the minority of what we're seeing in this state. I would next like to transition to talk a little bit about monkeypox, and to do this, I would like to introduce, I'm very pleased to introduce our new Deputy State Epidemiologist, Dr. Nathan Tan.
Hi, thanks, Sarah. To give an update about monkeypox and our vaccination effort. DOH has received 357 doses of the Jynneos vaccine, which is used to prevent monkeypox. Jynneos is a 2-dose vaccine. Doses are administered 28 days apart, and it has been approved by the FDA for safe and effective monkeypox prevention in adults. Getting vaccinated reduces the chances of getting monkeypox, and it can reduce symptoms if you do get it. While most people diagnosed with monkeypox experience mild to moderate illness, the rash and sores can be itchy and painful. People who get vaccinated should continue to take steps to protect themselves from infection by avoiding close skin-to-skin contact, including intimate contact with someone who has monkeypox or is suspected of having monkeypox. As vaccine supplies are currently limited, we have developed a strategy for vaccine allocation in Hawaii to protect those at increased risk of infection or severe disease. Nationwide, the current cases are primarily spread among social networks of gay, bisexual, and other men who have sex with men. So this community is currently at greater risk of exposure. The first phase will use this new allocation to vaccinate close contacts of people known to have monkeypox, and for people who may have had high-risk exposures in venues or areas where monkeypox is actively spreading. DOH is arranging vaccine distribution and administration in this first phase. In this phase, vaccines will not be available through your doctor. If you were a close contact of someone diagnosed with monkeypox, please contact your healthcare provider. We are working with healthcare providers to ensure that these individuals have access to vaccination. We expect to receive additional doses in the coming weeks. In the second phase, our distribution plan, broader vaccination of people who may be at risk of severe illness or future exposure will be considered. The federal government is ramping up production of Jenios. It expects more than 1.6 million doses to be made available nationwide this year. Hawaii will receive an equitable allocation. We will announce when vaccines become more widely available in Hawaii and ensure that vaccine is distributed equitably.
Thank you, Dr. Tan and Dr. Kemble. I will now take questions. Reporters, can you raise your virtual hand? I think I see Jen.
Yep, that's me. So I wanted to ask about COVID reinfections. How common is this? How common is it?
We believe that reinfection with COVID-19 is fairly common. It is difficult to collect accurate data on reinfection at the health department level. There are some medical sites which are able to track reinfection by following people with serial testing every week over long periods of time. But for most cases reported to us, especially now, many people may have previously been infected, but might not have gotten tested or might have tested at home without reporting it. So we don't have accurate numbers on reinfection. That being said, we do know from reports to us that people tell us they've had COVID before, and this is a common phenomenon. So reinfection is something that is happening.
Allison?
How many total cases of monkeypox have been confirmed in Hawaii?
Can you repeat that?
I think Allison asked about the total number of monkeypox infections in Hawaii, and Dr. Tan can take that question.
Sorry, I can. I was on mute, but yeah, total number of monkeypox cases diagnosed to date has been 6.
Thank you, Dr. Tan, and I think I see Zoe next.
Are all of the monkeypox cases related to each other?
Yeah, so of the 6 cases, we've established links between all 6 of the cases that we've diagnosed.
And I see Ali next.
Are all of these cases on Oahu or other islands as well?
Sarah?
Oh, that are all of the cases on Oahu? Yes, to date, the cases diagnosed with monkeypox have all been on Oahu.
And next up, I see Diane from StarAd.
Hey, could you be a bit more specific about the cases? Are they family members? Are they relatives? Are they friends? Or are they partners?
When we're looking at linkages between cases, it can encompass many different types of linkages. So being a household contact is just one of those, but it could also be other interactions that people have had. It could be sexual partners. It could be other intimate contacts. So it's a variety of types of epidemiologic linkage.
Thanks, Dr. Kemble, and then we'll do Allison and then Ali. Allison, you're on mute if you're trying to talk.
Tell me how many close contacts have been identified for those monkeypox cases. There were 6 cases. How many close contacts have you identified?
Sorry, we don't have the number calculated and readily available, but we have, for some cases, identified a number of close contacts, whereas for others, it may just be 1 or 2. So it's pretty variable.
Do you have enough vaccine for the close contacts that you've identified?
Yes, we've been able to vaccinate close contacts so far. We've had adequate supply.
And I see Nina's hand up.
Yes, sorry. I didn't know if I did it right. I can't seem to get that. Yes, I wanted to ask, actually back to COVID, I wanted to ask Dr. Campbell if she does think that BA.5 will eventually rise in Hawaii and have an impact. I mean, do you think it will cause another wave for us here?
Based on what we're seeing in the mainland US, I would say it's likely that BA.4 and 5 will continue to gain a foothold in Hawaii and we'll continue to see an increase or sort of takeover of the ecology of COVID-19 in Hawaii by those variants. Whether that will cause another surge is less certain. In some countries and jurisdictions, that has been the case, for example, in South Africa, whereas in other jurisdictions, it's less clear that that's driving increased numbers of cases. In Hawaii, I would say one thing that is going for us in a sense is that we've already had surges of BA.1 and BA.2 recently. So there is some cross immunity. But I do think we'll have to see if we begin to see more impact in terms of hospitalizations and severe outcomes as we begin to see more BA.4 and BA.5.
What should people in Hawaii know or do to prepare for that? For instance, I mean, is it getting boosters? Will boosters be just as effective? I see a lot of people no longer masking in stores. And so is masking still important?
Right, so you've hit on several tools in our toolbox that are still really important and protective to reduce COVID-19 transmission. Getting boosters is helpful. We do see that BA.4 and BA.5 are getting further and further away from what the original virus for which these vaccines were designed for. So there is some discussion at the national level of whether new approaches to vaccine might be in our future, but this is all speculation at this point. Right now, we do know that the currently available vaccines still reduce your risk of getting severe outcomes from COVID-19, including hospitalization and death. So the best thing to protect yourself is to be up to date on your COVID-19 vaccines. Masking is also still a useful tool. While some people are masking less right now, you also don't know other people's circumstances. Maybe they already had COVID in the last 90 days. So I think you're going to see more different types of behaviors at this point in time. But if you are concerned about your risk of COVID-19, wearing a mask is still protective and is a very good tool in the toolbox.
And one more question about masking. Are you going to recommend it for public schools this fall?
We are currently reviewing our school guidance and working on that as we speak. So we do hope to be releasing the new school guidance within the next week or two.
Thanks, Nina. And back to Ali.
Yeah, are there any updates on, inoculations for younger children? We know that part's kind of new, so anything you folks could possibly share on that?
I think you're asking about vaccines in younger children under 5?
Yes.
Yes, so those are now available, and we are beginning to see children under 5 going out to get their vaccines. I do recommend getting your children vaccinated if they are under 5. It is beneficial to protect against severe outcomes of COVID-19, including some of the conditions we've seen like MISC, which can be an immune response condition that can actually be quite severe in children. So these vaccines are recommended for children under 5, and now is a great time to do it before the start of the next school year.
Thank you, Ali, and we'll go back to Zoe.
Hi, what is the latest updates on case numbers for COVID and hospitalization numbers?
So our current daily average for cases is 651 over the last week. That was released this morning. In terms of hospitalizations, I don't know if Brooks has the number handy. I don't have it in front of me. We can get back to you.
Zoe, we can get back to you with that number, and I believe that Hanima just should have updated on
But the overall trend in hospitalizations has continued to decline.
Thank you, Zoe. And back to Allison.
Yes, can you tell me, are there any glaring differences between symptoms and outcomes for BA1 and 2 versus 4 and 5?
At this point, there isn't strong data to show a real difference in the outcomes we're seeing with those variants. But that is, I think, the literature we're watching for to see what emerges as we learn more about BA4 and 5.
Thank you. And we'll go over to Grant for next question.
Hey, I was hoping you guys could clarify who is going to be prioritized for the monkeypox vaccine. Is it close contacts right now, or members of the LGBTQ community, or who is the priority for those?
I can take that first. One thing I wanted to clarify is that the national vaccination program that's being enrolled is in 2 phases. So phase 1 focuses on expanded post-exposure prophylaxis, and that's looking at it's looking at close contacts and contacts of close contacts, but really trying to focus it on those who were very likely to have been exposed to monkeypox already. Phase 2 is looking at a broader pre-exposure prophylaxis campaign, and that's going to be looking more at risk factors and criteria for potential severe outcomes. So we are currently reviewing the CDC guidance on that. We're meeting with our neighbor island district health offices and other partners to devise a phase 2 plan, and that's been well underway. We have not yet learned how much vaccine we will receive in phase 2. And so we will be looking at those numbers when we get them and determining how to focus vaccine to reach those who are most impacted and most likely to have severe outcomes from monkeypox.
Thank you, Dr. Kemble. And before we go to the next question, I just want to clarify for Zoe that HIEMA has reported there are 164 people hospitalized with COVID today, and the 7-day rolling average is 183. And Grant, did you have a follow-up question?
No, that's it. Thank you.
Okay, thank you. And I see Ali is the last hand up.
Okay, so this is kind of more of a general question about COVID, but we saw in a journal that the leading cause of death for people between the ages of 45 and 51 nationally last year was COVID. Is that the case here in Hawaii?
I'm sorry, can you repeat? I'm having a little trouble with the audio. Can you repeat that one more time?
Okay, so it was reported that last year, the leading cause of death for people between the ages of 45 and 51 nationally was COVID. Is that the case here in Hawaii?
That's a great question. I'm not sure of the answer on that, but we can look at it and get back to you. There are statistics on the National Vital Statistics website at NCHS that do break down causes of mortality, all-cause mortality by state and for certain age groups. But we will try to get that answer for you.
Thanks, Ali. And if you send me or Brooks an email, we'll make sure to follow up on that. I don't see any hands up. Are there any last questions?
It's Nina at the Star Advertiser. I do have a question on the monkeypox. I wanted to see if we could get an update on contact tracing. How has that been going? Are you able to pretty much contact everybody of those 6 contacts? And is the team prepared for more cases in the future if we get more?
Right. As with any contact tracing activity, it can be difficult to reach all contacts, but we have been able to successfully identify lists of contacts for most of the cases and reach out to the majority of them. There always may be people who end up lost to follow up. And so that's part of the concern, to make sure that we also go broad in vaccinating around potential contacts of contacts and trying to make sure that we're addressing those at highest risk.
Okay, thanks so much, Nina. And if there are no more questions, I want to thank Dr. Kemble and Dr. Tan for their time today and all of you for joining us. Please feel free to follow up and we look forward to continuing to work with you. Thank you.